Hi, this is Dr. Robert Chao from Northern Virginia, reporting live from ACR 2021 for Room Now. I'd like to share with you some of the best abstracts in spondyloarthritis today, day 2 of ACR 2021. The first abstract is 902, looking at imaging of sacroiliac joints in the spine to see if they differ in patients presenting with undiagnosed back pain and psoriasis, anterior uveitis, and colitis. Overall, they found no difference in unilateral versus bilateral radiographic sacroiliitis and no difference in frequency, type, or distribution of the MRI lesions in the sacroiliac joints and spine. So this is very interesting because it showed that overall imaging the sacroiliac joints in the spine did not differ in psoriatic axial spondyloarthritis patients and axial spondyloarthritis patients associated with iritis and colitis. And perhaps that we could use an umbrella term of axial spondyloarthritis. The next abstract is 924, and this was the 2-year open label extension trial of upadacitinib from the Select Axis 1 study. And this looked at the efficacy and safety of upadacitinib in patients with active ankylosing spondylitis. Patients were randomized to upadacitinib 15 milligrams daily versus placebo in the original trial. And in this 2-year study, 144 patients were studied. Results were similar at 2 years compared to 14 weeks in the original trial, including maintaining the ASAS-40 response. The MRI SPARC spine and sacroiliac joint scores decreased at 14 weeks and maintained at 2 years. There were no new serious safety signals at 2 years. And again, infections were the most common adverse effects. There were no serious infections, tuberculosis, major adverse cardiovascular events, lymphoma, or non-melanoma skin cancers, or GI perforations. They did have one episode of a pulmonary embolism, but that was in a female patient with a previous history of a lower leg DVT with a history of smoking and obesity. There were also incidences of herpes zoster, colitis, and uveitis. And lastly, there were some mostly asymptomatic elevations of creatine kinase. So thanks for tuning in for live coverage of ACR 2021. Please visit roomnow.com and follow me on Twitter at Dr. RBC.